All right, let's get us started on time. Hello, and welcome to today's webinar from Benco Dental and Align Technology. My name is Reagan Connect, and I'm so happy to get us started. Tonight, we're joined by Mark Nelson from the Align Technology team, and Chad Carpenter, Chris Seaton, and Pat Montagna from the Benco Dental team. And we're also joined by our guest speaker, Dr. Jeff Horowitz. Dr. Horowitz completed his undergraduate studies at the University of Pittsburgh and earned his dental degree from the Medical University of South Carolina in Charleston. After completing a GPR at the Mountainside Hospital in Montclair, New Jersey, Dr. Horowitz founded the Carolina Center for Advanced Dentistry, a multidisciplinary group practice with 2 locations in the Myrtle Beach, South Carolina area. He's also the founder and clinical director for Advanced Sleep and TMJ Centers. His main interests include cosmetic smile rehabilitation, complex restorative cases, treatment of sleep disorder breathing, orthodontics, and temporomandibular disorders. An admitted CE junkie, Dr. Horowitz is a fellow of the Academy of General Dentistry, where he served as a past president for South Carolina on the National Dental Education Council. Dr. Horowitz also serves as a mentor and past scientific advisor at the Coy Center in Seattle, a key opinion leader and lecturer for Catapult Education, a clinical instructor for Sleep Group Solutions, and global faculty for Align Tech iTero. Dr. Horowitz lectures internationally and has been published in the dental literature, has contributed to many television news media reports, and most recently founded Dentists in the Know, an informational group on the Facebook platform. We're so happy to have you, Doctor, with us tonight to talk about digital scanning beyond restorative dentistry. So let's dive right into tonight's presentation.
I appreciate it, Regan, and so nice to be with all of you tonight. Thanks for taking time out of the busy work week to hang out and talk a little bit about digital scanning. I'm going to jump right in because we only have an hour, and I understand that there's a pretty hard stop. So I'm going to try to get through this in about 45 to 50 minutes at the most, leaving a few minutes for question and answer, and we'll have you all back to your families in the hour. So I'm not going to talk a lot about myself here. I think that when you can look at all of my bio here, all I want you to take from this is my email address at the bottom. Regan read a whole lot about me. You don't need to know a whole lot more than that, other than I have a practice here in South Carolina. I am a regular practicing dentist, just like everyone else out there. And for me, I want things to be as practical as possible, and I really want things to make life easier on my patients as well as my team. So we're going to talk about that as we discuss technologies. That's my crew that you see on the upper right-hand side of the screen. That's Dr. Bachler, Dr. Collins, and Dr. Lawson. Those are my associates. I started as a solo practice. It grew up into a larger practice here in Conway, South Carolina. And then as my education increased in the areas of sleep and TMJ, I decided to open up a sleep and TMJ practice as well. And we have 2 other locations where we do that. So please write my email address down. Please feel free to email me at that address there. In the subject line, if you would, please put lecture question, and I will be sure to get to those within the next 24 hours. As long as I see a lecture question in the subject line, I will absolutely get right onto that. Quick disclosure, I am part of the Catapult Key Opinion Leaders Group and Speakers Bureau. We test a lot of great products out there. We hope a lot of companies bring products to market. We give them honest feedback. We do not get our products for free. Anything that we talk about or discuss or help bring to market, we have to purchase just like everyone else does, so that when we talk about the merits and when we talk about these things, that these are products that we have not only paid for, but use every single day within our practice. So with that said, there are 2 special companies I want to thank for tonight. And of course, one being Align iTero. I was a big Invisalign doctor. In fact, one of the first GPs doing Invisalign. And so I have a long history with them, tried other companies and kept going back to Align for my aligners, only because I never found another company that did it as well as they did. Few years down the road in Catapult Education, I became familiar with iTero 3D scanning. And as I said, we've had the opportunity to try many products. iTero is the one that I use within my practice. I want to thank them for helping to sponsor today. There are alternatives out there. I will be speaking from personal satisfaction and from personal experience with these products. Also want to thank Benco Dental for sponsoring this event tonight. We appreciate all of their efforts to bring you great education. As mentioned in the introduction, Align and iTero have been great supporters of our program called Dentists in the Know. Dr. Chad Duplantis, Dr. Jennifer Bell, both Catapult educators with myself. We started a Facebook group where we could have good, honest, and polite conversation about what's going on behind the scenes in dentistry. It's 100% honesty, and we'd love for you to join. So if you would, just scan on that little QR code that you see. We'd love to have you be a part of the honest conversation on Dentists in the Know. So with that, let me talk to you about digital scanning and my digital journey. So digital has always played a very important role within my practice for a lot of reasons. The first thing that I always felt was that it had to be extremely important to the patients to be able to see whatever problems they were having. So rather than me trying to draw diagrams and trying to explain it, I always felt that if a patient could see their problem, they could better understand their problem, that they'd be more likely to move forward with treatment. And so that's always been at the backbone of everything that we've done. So you can see some of the old tools that I used. I had one of the first AccuCams, which was an analog video camera where we could look at the teeth, one of the first intraoral cameras that we used for show and tell. I moved up then to an UltraCam, which was still analog, but what we found with all of these technologies, as cumbersome as they were, and the fact that we actually had to physically print pictures out, we weren't even on a screen at the time, was that once patients could see the problem, it really made it easier to get them to say yes for the things that they needed, because now it wasn't just a sale anymore. Now this was solving a problem that they actually believed that they had. And so that's really where this goes as we talk about digital technology, is how do we get patients to appreciate the problems that they have? So as things evolved and we became truly digital, we started looking at some restorative options and how we could get restorative dentistry to our patients more efficiently. So we could use a digital scanner like this one that you see. We'd be able to mill our own restorations in-house and make things more efficient for the patient. A lot of limitations with this. We couldn't really scan full arches very well. We were limited to single tooth restorations and maybe one or two teeth at a time. It took a long time. Now, there's some drawbacks to it, but certainly had a place, and my patients certainly saw the merits of having digital scanning within the office, and it did help them see what the problems were with their own teeth. So from that point, we moved up to digital radiography, where we could now put their x-rays up on the screen and make the images, 5 times, 10 times the size that they were when we had film. So again, this is all about show and tell. We're able to move into things like cone beam imaging to also help show the patients where their problems were. As we became more refined in all of these different types of technologies. We decided to move up to something that was faster at scanning and milling, but I still had a big problem. I still did a lot of work with sleep. I did a lot of work with TMJ. I was still only able to mill a unit or two at a time. I couldn't really do full arches. It wasn't really good for show and tell with the patients. And I just knew that I had a lot more that I wanted to do. I was very involved with Invisalign. I needed to be able to get my cases to Align Technologies to get my aligners made more efficiently and to get the turnaround to be a lot faster with my Invisalign cases. We also had things like TMJ and diagnosis and treatment planning and implants. And we wanted to start thinking about digital printing, 3D printing models, so that we could have them right there in the office. We wanted to think about ways to make night guards more efficient and ways to treat TMD more efficiently. And yes, even though this is beyond restorative, this lecture, I wanted a way to make my restorative dentistry more efficient as well. So with that said came the eye opener. When I started looking at the brand I was using and started looking at upgrading to something that would give me full arch scanning capability, what I found out was that it was going to cost me basically another house to do so. And I had been with this company for a long time. I had already fully upgraded one time and was willing to take the plunge. But this time around, I said, this is really not cost efficient to have, to every time that I want to upgrade my system, have to make this type of an investment. And so my good friend Chad Duplantis from Dentists in the Know and from Catapult Education, he said, Jeff, I want you to check out iTero and look at their 3D scanning capability. He said, I think you're going to be amazed at the way that it integrates with a lot of restorative milling technologies, with an open platform and the ability to go to many different laboratories out there and the abilities that you're going to have within your own office. I think you're going to find this to be a really, really good option. And so I listened to my friend Chad and I said, listen, I think that's a great idea. I already do a bunch of Invisalign and this is just going to make it a lot easier. And I was able to add my first iTero Element 5D, and I'll explain what the 5D means. The iTero Element was the first in their scanning technology. They added 5D, which gave you some caries detection abilities, and I'll talk about that a little bit more later. But this was a very versatile instrument that now allowed me to integrate with multiple platforms and now be able to directly submit all of my scans directly to Align, creating a quick turnaround, giving me the opportunity to also do mock-ups of the Invisalign to actually show them what their teeth could look like, and again, get to yes much, much faster. So when we talk about this, the iTero alternative, I now had the ability to do really, really fast full arch scanning. We also now had the ability to do a functional analysis by looking at the occlusal wear facets and being able to look at abfractive lesions. I was able to provide a more comprehensive diagnosis right there in front of the patient and have the patient point at the screen and say, what's going on there? What's going on there? What's going on there? The 5D technology now that iTero is offering has something called near infrared caries detection. So on top of using it, not just for function, not just for restorative, not just for being able to make appliances, now we can actually use it as a diagnostic tool, which helps us find interproximal carious lesions. It helps us find fractures. And it does so, some of the newest studies that are out are showing us that it is doing so almost with the same capability as a bite wing x-ray. And I don't know about you, but I am moving away from taking intraoral x-rays as much as I used to. We're now using more cone beam imaging as a preliminary scan, and a lot of our caries detection and other methodology that we used x-rays for, we are now using our other technologies for, like the iTero and the near infrared caries detection tool. So we have great access to all these scans. I don't actually have to be on my iTero scanner. I have a program or an internet service, which is all you really need, to log on to my iTero. And through my iTero, I can access any scan that was taken with any one of the 3 scanners that I now have, excuse me, from iTero. So what are the opportunities here? Well, first of all, connectivity. So the biggest thing that I talked about were these simulators. I was already doing a lot of Invisalign, but all I could do is really tell my patients, look, I think we can do a nice job for you. And once we submit your case, we'll be able to look at the ClinCheck. We'll be able to look and see what the 2 setup looks like, and then you'll have the ability to approve that or not. Well, now, because we're taking the scans with our iTero right there on the spot, I can run my Invisalign simulator right then and there on the spot, and the patients can look at it and have that wow factor and say, wow, you mean you can do that? How much more do I have to do? Well, guess what? I've already got your scans. All I need to do is take a bite, take a couple of photographs, and we are off to the races. We can start this as soon as you want. What I like about having these scans right away is also that, let's say a couple of months down the road, the patient wants to come back and visit that. All of those scans are already in there. I can access them from my iTero, submit them to Align, and have my Invisalign case back very quickly. I also like the connectivity and the open platform that's offered by iTero, because we can send our work off to many labs. They also offer a backup plan with some of their scanning systems with labs such as Glidewell Laboratory. There are other laboratories that do this as well. Glidewell is one that, if you use their milling system, that they will actually serve as a backup should anything not mill. Just another opportunity that's out there. Patient communication. And, I don't have to say this more than once, but the return on investment from comprehensive diagnosis absolutely makes this a no-brainer. Just by getting a few more patients to say yes, you can already throw away any concerns that you might have about, is this technology going to pay for itself? And yes, that's something I ask myself before I put any technology in the office. Is 1, is it at least going to pay for itself? 2, is it going to make life easier for my patients? Is it going to make it more comfortable for the patients? And is it going to make it more comfortable or efficient for my team? So if something just covers its own cost and accomplishes those goals, I'm ecstatic. Well, this goes so far beyond that because of all the abilities. So if you took everything else out there, just the number of yeses that we get and the number of the increase in Invisalign cases that we're doing alone, absolutely pay for this technology. And I'll talk more about ROI as we move on, but I just want everyone to feel comfortable that this is not to be thought of as an expense to the practice. This is actually a source of revenue for the practice. So lots of things that we can do. We talked about all these opportunities that are there. It all begins with scanning as many patients as you can. Why? Because now you have the talking points, you have the caries detection, you have the ability to do an Invisalign simulator, you have the ability to show them the wear facets, the abfractive lesions, the signs of bruxism. You have the ability now to take these same scans that are already imported into your iTero and do multiple things. So you're not having to bring them back for impressioning appointments now. So once I learned this, and after taking my friend Chad's recommendation to buy my first iTero Element 5D, my next move was to buy my second iTero Element 5D and put it in my satellite office. So now I had one in each of the office, in each of my two offices. And this was all well and good. And we now try to scan every patient, but I'll tell you what's ended up happening is we've had enough of our team saying, I can't get a hold of the iTero scanner. Ashley's using it for sleep and you guys are using it for all of this ortho now. And we want to be doing all of these initial scans in hygiene. So guess what? We ended up just purchasing our third iTero scanner. So we have two scanners in one of our locations. I'm sure we'll soon be adding a second scanner in our second location. It's just a no-brainer. As long as those things are being used, they are not only paying for themselves, it is a constant stream of revenue through the practice. So I think Dr. Fitzgerald asked if this technology was available to use in remote locations. Yes, one of the coolest things, and especially I'm going to talk a little bit about the iTero 5D Plus that was just released. They actually have a portable version of that so that you could carry it from location to location if you wanted to. And I'm glad you mentioned that because that's something that I'm looking at doing, especially having now opened up a third location. It would be nice to be able to make that as portable as possible. So again, other reasons for taking that initial scan right away, it's prevention. We have the ability to look at these areas on the screen and the patient can see what happens over time, how abfractive lesions can get worse, how the wear facets or erosive lesions can get worse. And there's a legend right there. So the patient in real time can see, and with time lapse offered by iTero, to see what's happening to their teeth over time. So again, the patient doesn't have to say yes to everything the first day they're in the practice, but we have the ability, because these scans are stored and we have the ability to run this time lapse, we can show them, listen, we talked to you about the erosion that's going on. We talked to you about the acid reflux. We talked to you about the bruxism. I want you to see the time lapse from a year ago when you came in to now, or that abfractive lesion or non-carious cervical lesion, whatever you want to call it. But having that ability to go back and having access to all of these scans readily without having to go to the physical unit itself, we do this through the portal, through the My iTero portal. We have the ability to do this from any computer in the office, which is nice. Evidence of bruxism, we can look at how heavy the contacts are, where the contacts are at, if they're contacting too heavily in the anterior, if they've got a constricted envelope of function, is there a need for orthodontics here? So again, this is something that we can pull up right away. We take a scan, a bite, and we can look at these occlusal contacts right off the bat. We can see the wear facets. If we see the bruxism, or if we restore the bite, we can then look at it in time lapse as well and say, look, here's what we did to your bite. Here's how we were able to open your bite. Here's how we were able to get the forces off of those front teeth for you. What about patients who have myofascial pain, or if they do show signs of bruxism, or they're having masseter pain? This is a lot of patients that are out there. This is a study that goes way back to 2008. And TMD or TMJ problems is estimated to occur in about 20% of the general population. So bruxism, I believe, if you're going to call it true nocturnal bruxism, may occur a little bit less than that, but certainly the signs of bruxism and clenching can occur in at least 20% of the general population. And I would absolutely agree with that anecdotally. Approximately 22% of patients self-report that they grind their teeth at night. 67% of the participants in this particular study said that they didn't. So there's a little discrepancy there. And 11% were not sure. They bruxed occasionally, or they didn't have teeth. So this is a study that was done by Gia Levine, and any of you who are involved with sleep know Dr. Levine as one of the leading authorities on bruxism in dentistry and in the medical field of airway. So the consequences of bruxism, obviously we can have breakdown of the teeth, wear facets. We can start to develop CRCO discrepancies, tooth fractures, hypersensitivity, mobility. We can get cheek biting. Certainly start to see problems with the masseter, tenderness, or fatigue. When patients try to chew, we can see muscle spasm, and then certainly tenderness within the TMJ, which can manifest sometimes as ear pain. So we have the ability to look at these cases. We can scan them quickly. And what about that instant fix? How important is that? Maybe even not the instant long-term fix, but the instant, I care about you, Mr. Patient or Mrs. Patient. I want to do something that takes care of this right away, whether it be a temporary night guard, whether it be a temporary TMJ splint, whether it be a temporary sleep apnea appliance. And for that reason, once we began using this technology, the next step for me was to think about 3D printing, because now I could actually make these in the office the same day. But you don't have to do that right off the bat. Get to scanning first. Learn scanning. Learn all of these tools that are available to you. Once you get those down, look, you can send that to the lab and have it back to your office within just a couple of days. That's still a much faster turnaround time than we were talking about in years past, right? So we have the ability to take our scans in a case like this. It's a real easy workflow process. If we decide we want somebody else to design the temporary splint, the night guard, the temporary TMJ appliance, we can send it out through a portal and let an outside company design it. If we want to design it ourselves, we can buy the software to do so. It's a little bit more expensive to do it that way right off the bat, but it saves money long term. Doesn't matter which way you do it. I don't care. I'm just talking to you about the workflow here. So you could ship this out, let somebody else design it, send it back to you. You can let someone else design it and actually make the temporary appliance, the sleep appliance, the TMJ appliance, the bruxism appliance, whatever. Or you could turn it around yourself in an hour, be printing, and have an appliance ready for that patient within the next couple of hours. So it doesn't matter how you do this. In our case, we're able to import it back in. We send it out to be designed. It gets designed out there. We have it back in about an hour or so, always within 24 hours, but usually within an hour or two from when we send it out. And we can print it right there on the spot. We can polish it and then put it directly into the mouth. And now we have a night guard that fits beautifully. And I will tell you, once you start scanning and you start fitting things in, and I'm not talking about the stuff that you print yourself, I'm talking about the stuff you scan, send out to the lab, have it come back. You're going to have fits on your night guards like you have never had before. You're going to have fits on your sleep appliances like you have never had before. And I consider my team some of the best impression takers out there. I mean, I am a stickler about impressioning. And I will tell you that we just don't have the problems with 3D scanning that we do with impressioning, particularly when it comes to fit and occlusal interferences. So what about the ability to have something like this the same day, or the ability to have something like this in just a couple of days? That's an incredible opportunity for you. It's something that sets you apart in the dental world. It's something that makes you very different from the last dentist that they came from. And honestly, people talk about the cost of technology. I hear that, and to me, technology that makes life easier for my patients or more comfortable for my patients, more efficient, makes it more comfortable, more efficient for my office, it's a no-brainer. I mean, all it has to do is cover its own cost, and I'm all in on it. But the fact is that this never has a way of not having a positive ROI unless you just shove it in the corner. And I cannot imagine doing that with this kind of technology, because there's just too many opportunities for dentists in all areas of general practice. So what's the cost of technology? No. What's the cost of obsolescence? I don't ever want to be that dentist that falls behind the curve, and a patient comes in and says, "Well, my last dentist, had the ability to scan me and not have to put that goop in my mouth anymore." We're getting to that point, and I think it's time that really, for most dentists, look, I'm a 50-something-year-old guy, and I can't imagine practicing without this technology now. It's just where the profession is going. So we have the ability to make, in this case, a TMJ splint, a BRUXISM splint, something that can be fabricated same day, next day in my own office, within 2 days if I'm sending it out. But the patients are so impressed. And, what's the value of your time? Because when these go in, I will tell you the adjustments are much fewer and more far between than they are when you use traditional VPS or polyether impressioning techniques. So that's doing night guard or TMD therapy. But, let me talk about something that's really near and dear to my heart. Many of you know me from talking about sleep apnea so often. I've lectured on sleep apnea for the last, almost 15 years of my life. It's something that's been a big part of my practice for a long time. And I think anything that makes us a better comprehensive dentist is something that we all need to know about. And so I think every dentist, whether they're making sleep appliances or not, needs to understand the basics of sleep apnea, because we're typically the first ones that are going to spot the signs and symptoms for patients. And we have the ability to save lives here. And so that becomes really critical. But let me take this a step further. All these patients that have bruxism, bruxism is very often associated with obstructive sleep apnea. So in many studies, we've learned that many people with OSA are also grinders. Why? Because when a patient has an apneic event, we get a triggering of the sympathetic nerve system as a response to the oxygen deprivation. So CO2 receptors in the brain pick up increased CO2 levels, kicks in the fight or flight response, and we get this neuromuscular event. So we get an awakening or an arousal. And when the arousal occurs, we get all this aberrant neuromuscular movement. And much of that is masseter movement that manifests itself as tooth grinding. So the use of a night guard may alleviate some of the symptoms, but please know that if you have a patient that has sleep apnea, the likelihood is greater than 50% that their apnea-hypopnea index could become worse by putting a flat plane splint in. So we have to ask why they're grinding, not just are they grinding, why are they grinding? We should be ruling out sleep apnea as well. The good news is that we have the ability to do that with pulse oximetry, with the ability to refer them out to a sleep physician, the ability to offer home sleep testing to be able to rule that out and still have the patient treated in a very quick manner. But just to have this said that, listen, I'm all about night guards. I think they should be made in any patient that bruxes, but we should also make sure that we're paying attention to sleep apnea and ruling that out as a potential cause. So wait a minute. We're talking about restorative dentistry. We're talking about sleep. We're talking about night guards. And so I needed another machine. And so when we went to the new scanner, iTero had come out with their new 5D Plus. Again, the 5D was that fifth dimension that allowed us to look at carie screening with near infrared technology, which was an amazing addition to the iTero element. But now with the Plus, they actually increased what was already, decreased what was already an amazingly fast processing time. The visuals are much, much brighter. The images are much more vivid. They've actually put an artificial intelligence chip into this technology, and we're going to see those technologies become more and more prevalent. And we're going to have more and more use for those things. So when I was ready and the 5D Plus had come out, that's what we had sent to our first office. And it is absolutely amazing. In fact, we were using it just this afternoon, starting another Invisalign case. So, and that's actually my scanner that you're looking at right there. But with all that said, let's go back to sleep for a minute. And I just want you to see the potential that's here. So we see a lot of kids because I do orthodontics and we're a comprehensive practice, but we see a lot of consultations that, like this young girl, she was brought in because kids were making fun of her. And so we were able immediately to do a scan, but in looking at the scan and looking at the wear facets on the teeth and looking at the lip posture and looking at the throat, I said, this isn't just an orthodontic problem. This is an airway problem as well. So I was able to show mom the scan. I was able to put it on an orthodontic Invisalign ortho simulator, because Invisalign or Line Technologies actually has a product called Invisalign First, where we can take children like this, we can expand their arches, we can straighten their teeth, we can stop the bullying, we can improve their airway by advancing the mandible, improve the class 2, and expand their arches all at the same time. And so I had the ability to show mom this. And we have to understand that a lot of these orthodontic problems that we see are due to airway impingement and poor swallowing and arch development problems. So now here's show and tell time. So this is that young lady that we were just talking about. You can see the severe class 2. You can see that the lip postures under those anterior teeth. So we were able to submit that to Invisalign. We were able to show mom that we could actually increase the arch width, bring the top teeth back, put her into mandibular advancement. So correcting the class 2, improving the profile right away, and really taking the amount of time she would need to spend later in phase 2 orthodontics down dramatically. And when I say dramatically, I mean dramatically, because if I can get that class 2 corrected and I can get her growth and development back on track, because I'm also solving the airway problem at the same time, I have done a tremendous thing for this young lady. So here is our ClinCheck treatment plan that we see. Mandibular advancement is going to land the teeth in this proper class 1 occlusion. We were actually able to correct teeth number 8 and 9, and the tipping that you see there, actually that's a torque problem, but from the poor lip posturing. So we're able to help the lip posturing. We're able to help the positioning of the teeth. We're able to stop the bullying. We're able to give a young girl confidence right away. So that's exactly what we did. That's the arch form that we started with. That's the arch form that we were going to get to. Pretty incredible. When you increase arch form like that, you also increase the size of the nasal airway. And so in this case, this young lady was able to start breathing better without having to have the tonsillectomy and adenoidectomy. And I always recommend working with your ENTs to make sure that they don't need to come out. But if you can avoid surgery, why not avoid surgery if you can? So this is where we started. This was in June of 2019. These are the appliances in place in October of 2019. And you can see the great posturing. Her profile had already improved. She had already developed more self-confidence, but this is really what I wanted you to see. And I'm sorry that says 2 months, but that's actually 4 months. That is 4 months of growth and development from June to October of the same year. Now, what we've learned through the research is that by getting a child to breathe better and sleep better, we get an increase in growth hormone. And that is evident throughout the literature all over the place. The ENTs have been finding that when they did tonsillectomies and adenoidectomies, but us, by being able to offer her Invisalign first, put her into mandibular advancement while we were increasing the arch width, increasing the nasopharyngeal volume and the nasal airway, and improving her self-confidence all at the same time, she had a release of growth hormone and literally looks like she aged 2 years in the 4 months that we're talking about here. Mom was absolutely amazed, and we have patients for life. So, don't underestimate the abilities of what we can do with scans. We've also had patients who are adult patients that we've realized after we took the first scan, oh my gosh, this is a sleep patient, or they come to us for sleep at some point. Well, guess what? We already had the scan. So making them a sleep patient becomes really easy once we have the sleep study. Now I have the ability to take those scans. I now can put them through my sleep dentistry protocols, and it's as simple as getting the proper bite and then sending that off to the lab. And now instead of waiting weeks for a sleep apnea appliance, I can have a sleep apnea appliance in my office within days. And now with 3D printing technologies, I'll be able to make them a temporary sleep appliance, have it to them that same day while I'm waiting the few days for the laboratory made appliance. So, and they can also keep that as a backup. So, oh yeah, we had the scan. In my case, we're going to take the bite with acoustic reflection. That's how we're going to determine the best position for the patient. This is rhinometry and pharyngometry with acoustic reflection. Again, this is a whole other discipline. That's not what this is about. I'm just showing you that we use a little tab and we use sound waves to find the best airway position for the patient. Once I have that tab in place, we can now take a buccal bite with our scanner, and it's just a matter of getting in there on the side with the wand all the way around. It then gives us our bite position, and we can fabricate an oral appliance and have that appliance back within just a couple of days. And I will tell you, that is a great day. The ability to do things that efficiently, the ability to offer patients services that happen within a couple of days versus a couple of weeks. We're now on the verge of offering most of our services within the same day. The ability to have show and tell, like was my first goal when we first got into digital scanning technologies and digital technologies. I'm finding all of these things are available to me, and that's a great day, like the first time you hear the band Rush. I used to play a Rush song at this point in the presentation, but apparently there's some issues with licensing and copyright laws, so we're not doing that anymore. But just imagine me playing a song by the band Rush. So let me just summarize for you all the abilities that we have with iTero, with the Element 5D, with the Element 5D Plus, and the many portable options that they have. we have connectivity. So we can go straight through to Invisalign and their simulators. And those simulators have been a great pathway to yes, very, very quickly. We have great connectivity because of the open platform to many different labs, to the 3D printing portals, to different milling machines. We have incredible patient communication. We have an absolute return on investment just based on the comprehensive diagnosis that we're now offering to all patients. We are saving on our impression materials and our bite registration materials, on our trays. The patients are happier. We are saving time in the operatory. And we all know the time is money. I mean, it cannot be said any more strongly, especially in dentistry. We get the return on investment because we're now able to produce multiple units in practice with the new milling option that we have, and even multiple units coming from the lab within a couple of days. We're now going to doing our own full mouth temporaries with 3D printing on the same day. So the ability to be able to do a 3D wax up on the same day and not have to send it off and get waxed and make lab temps. We have the ability to do all of that right there at our fingertips. The ability to do sleep and offer TMJ services, BRUXISM appliances, orthodontics, implants, periodontal trays, which is becoming a big new fad, being able to deliver periodontal medicaments through trays, through very well-fitting trays. They absolutely want us to be scanning versus sending them traditional impressions or traditional models because they know the fit and the intimacy of the fit is going to be that much better. So a lot going on here. That's a whole lot of information for all of you. So I'm going to close out by leaving you with a saying that I close all of my lectures with, which is your beliefs don't make you a better person. Your behavior does. I want to thank Align iTero for all the support that they've given me over the years and for their dedication to the technology and to the research and development that makes technology like this possible. I want to thank great dental suppliers and like Benco Dental that are there to help service and to help take care of all of our needs within practice. I want to thank my fellow Catapult educators. I want to thank my fellow Dinks, JB and Chad. There's my email address. And with that, I'd like to leave it to a few questions to the gallery.
Well, thank you, Dr. Hurwitz. We do have some questions, but it was great to see that you do have the 5D Plus. I think one of the questions that everyone wants to know in attendance tonight is, what are your first thoughts of it, right? You did mention a little bit about it. What are your favorite things about it so far?
So a couple of things. One, and I always listen to my assistants because when you really begin using this technology well, you will have your team really well trained because it frees up so much time for you. So the first thing I do with newer technologies, we had the iTero 5D. First thing I did is hand it to my assistant and say, you take the scan and tell me what you think. I want their opinion first. First thing is, wow, the image is brighter and it's faster. So right away, they could tell that the processing time was much, much faster. So not nearly as much time waiting for the bites to integrate, not nearly as much time waiting for it to pick up the last place that you scan. Having come from other scanning technology before, I'm not going to mention the name, but having come from another company before, they were blown away just with the 5D technology. So when we went to our first iTero, like, oh my gosh, we just took a full arch impression in 2 minutes. Like that was an all-day event before with our older technology. So for them to even say that the 5D Plus processed faster than that was really impressive to me. We already had the NIRI technology, and we love that, but having this second machine now is allowing us to use it more in hygiene so that we can be adding to all the capabilities like diagnosing, interproximal decay and fractures on the teeth.
Awesome. That's great to hear. And you kind of mentioned training there. So there might be doctors in attendance tonight that don't have a scanner at the moment. So what was the onboarding like for something like this? For, you might have several hygienist assistants to get up to speed on the scanning technology. Can you explain that a little bit?
So yeah, they actually do this brilliantly. They have a camera that's set up on the iTero itself. So your team trainings occur right away. It's a virtual event that happens back and forth, and they get them scanning right then and there on the spot. So everything is sent to you. It's being done that way. When we got our first one, we had an amazing in-person training. COVID hit, right? So we had to watch things go to virtual a little bit. So I'm sure we're going to start to see even more live training again. But I'll tell you, they have done such a tremendous job with their virtual training and being able to hand the camera off and wheel the camera around to each of the different assistants and hygienists, have them scan the arches, and in real time be able to get the feedback from the trainer on the other end saying, no, you need to hold it a little bit differently. No, try this position, because there's also an external camera that's watching the assistants as they're actually doing the scanning. They're not just watching, the scanning that's going into the computer.
Gotcha. So even though they have a virtual training, it's like they're right there in their office with you anyway.
It is just like having someone with you, because they're watching the behavior of the person who's actually doing the scanning, as well as what's being scanned into the computer.
Excellent. Now, in the pediatric case that you mentioned before, we did mention some pediatric cases. Now, is the pediatric application becoming more routine for you in your practice?
100%. So sleep is moving more and more pediatric. It always has. That's how I got into sleep. So when I first moved to Conway, South Carolina, we only had one pediatric dentist in the entire county and one orthodontist in the entire county. They shared an office. And so we had this huge backlog of patients that needed to get in for ortho. And so I'm going to go learn how to do ortho, and I'm going to learn how to do pedo. And so as I went off over the next 5 years to, driving back and forth to Atlanta to learn ortho, what I really learned was about growth and development. And I was learning about airways and how airways developed, and the fact that not intervening in children was not only keeping them from reaching their growth and development potential from an orthodontic and orthopedic standpoint, but it was also keeping them from being healthy because their airway was suffering if they weren't growing and developing properly. So yes, this has become absolutely routine with our pediatric patients to go ahead and scan them. Go ahead and look for wear facets, look for signs of bruxism on young children, look for growth and development problems, cross bites. You can show that to the mom without having to pull the kid's cheek back. And the kids love it. It's like a video game to them. So it's so different than coming in and saying, okay, young one, I'm going to stick this bunch of goop in your mouth right now. It's like, hey, let's take a look with this cool camera and you can watch your teeth on the TV. And they love it. So it's a whole new way of looking at children. Oh, lost your sound, Chris. You're muted. There you go.
That was the quote of 2020, right? You're muted. So
yeah.
Now let's switch gears a little bit here. So we've saw a little bit of chairside milling. So when do you decide to mill chairside and to send to the lab? What was that case look like?
Virtually every case every single unit case that is done, as long as it's not like a single central or something like that, that's going to take a master technician to nail down. Pretty much every single unit case, up to 3 units most of the time posteriorly, is going to be in-office milling. Anything where I'm really going to need some artistry, where I'm going to have multiple units, where the milling time might just exceed the amount of time the patient wants to stay in the office, I'm going to send that scan out to the laboratory. But the great thing is they have it that day and they're starting to work on that case right away. I can have the case back in days instead of weeks. And there's no issues with, oh my gosh, I hope they don't pour this up and find a bleb. I hope they don't pour it up and say, oh, hey, guess what? We need a new impression. No, you know right then and there what your scan looks like. And having that kind of immediate feedback is also pretty amazing.
Yeah, I think that's really the beauty of intraoral scanning. And one of the things that has really made it progress was you get to see that firsthand before you send it out to a lab or internally for your designer. Now,
it makes you a better dentist too, Chris, because seeing it big in front of your face like that, it's real easy for docs to kind of look at the impression real quick and go, yeah, that's good. But when it's up on the screen in front of you like that in real time, that's where you say, okay, I could have prepped that a little bit better. It's right there. You can't deny it. So you're less likely to send something off to the lab that needs help.
And it stops those tough conversations at the lab as well, right?
Exactly.
So you had a lot of technology for those doctors out there that might not have scanning technology, 3D print technology, and they see it as a big expense. What would you say to a doctor like that that's taking their first step into digital with the upfront cost that there is?
So, first of all, I'm going to say that it will absolutely pay for itself within the first year. If you're using this technology properly, so if you're using the near infrared technology, you are going to find interproximal caries that you will absolutely miss on bite wing x-rays. I'm telling you, you will, because of the way that it shows up. It is so clear cut. You will find fractures that you wouldn't have otherwise found. The other thing that you're going to find is your cosmetic and your what I would say the fluff cases, the cases that make dentistry great and not, the grinded out working on tooth by tooth cases. Having the ability to talk about straightening the teeth and simulating that right there at the first appointment. Do you know how many people just go, wow, I didn't know that was a possibility. So you can pay for the unit with one Invisalign case, 2 Invisalign cases. You can pay for a year's worth of payments in just a couple of Invisalign cases. You do a couple of NIGHTGUARD cases. You don't have to put the milling in your office right away. You don't have to put the 3D printing in your office right away. The first step is the show and tell and the ability to shorten the duration and make the process more efficient for patients and for your team alike. Everyone will be happy. You're muted again.
I've actually demoed the iTero scanner, and one of the aha moments for doctors is that outcome simulator. So it is a great option, but we're actually out of time tonight. So I would like to thank you for presenting tonight. I'd like to thank Align as well. And for any doctor out there that would like to have a demo, please contact your local friendly Benco rep. And if you do purchase by the 30th of the month of April, we will give you 4 free boxes of tips. So I'd like to thank everyone for tuning in tonight. Have a wonderful evening.
Thanks, Chris. And they can contact me at that email address with any other questions. Have a good night.